Hi friends, I am discussing about direct anterior hip replacement surgery in this video. So as you all hear, the word direct is direct, anterior is front, hip replacement is hip replacement. So what is the difference of this surgery compared to the routinely done posterior hip replacement surgery? This is hip joint, you can see that. This is the front of the hip. What you are seeing is the front. Normally we do surgery from the back and we are going to replace the implants with the cup, the socket and the stem and the head. The traditional way of doing this procedure is by doing the incision in the back of the hip joint like this. This is called posterior approach to the hip. Why we are now doing something different? In fact, this is not that new as you might be hearing new, but this procedure is there from more than 10-15 years. Direct anterior hip replacement is the surgery where the hip is approached from front of the hip, means front of the thigh. Why this procedure is now becoming popular is because muscles will be only split and separated and hip is going to be implanted when person is lying down supine, means on his back. Whereas the posterior approach hip replacement is done with the person lying on the side, and which hip is involved will be on the top. Since we are not cutting the muscles, we are only splitting the muscles, bleeding will be less and surgical incision will be smaller. And as we don't cut the muscles and capsule, the chance of dislocation is very less. This is the hip joint. Sometimes, very rarely, hip comes out like this. In some of the very awkward positions of the leg or some of the extreme positions of the leg or internal rotation, too much rotation of the leg, sometimes hip comes out like this. In order to avoid this, in order to prevent whatever 1-2% chances of this hip coming out like this, there have been a lot of changes and improvisations and refinement of the surgical skills and techniques will be happening. In that, one of those things is called direct anterior hip replacement. Since we are not touching the muscles or capsules, anything from the back, there is no possibility that this hip will come out, dislocate. Since we are not damaging any of the capsules from the back and it is not dislocating, person is given the freedom of sitting on the floor, squatting and all the activities. However, with the exact position of the implants, even with the posterior approach, people are able to sit on the floor, people are doing all the activities. You can say that this is one step ahead of giving extra range of movement to the patient with the confidence that yes, it will not dislocate, you can do that. That is the advantage. The flip sides of this is, since it is operated from front, there are some possibilities of some cracks happening if it is not properly done. Sometimes something like too much of effort required to put the position in such a way that stem goes properly in particular angle which is ideal. So the regular procedures and doing repeatedly, one can acquire the skill in order to overcome this small technical challenges, as I can say. And another thing is that since it is the approach to the stem part, the femoral part is very small from the direct anterior approach. If there has been a previous surgery in the hip, some plates and screws or some other procedure has been done before, and sometimes we do something called dysplastic hip, something called hip replacement for dysplasia, shallow acetabulum and proximal migration. These are the people who are not ideal candidate for direct anterior hip replacement. Sometimes we do revision hip replacement, means we are going to change these implants and put the new implants because of either loosening or infection or failure of the first operated hip replacement after so many years. Then these people are not fit or ideal people to perform surgery from direct anterior. So then the question is, who are these ideal people who are fit for direct anterior hip replacement? The most ideal people for the direct anterior is primary osteoarthritis of the hip, acetabulum and femur without any previous injury or without any previous surgery or anything like that. Another common condition which is suitable to be a direct anterior hip replacement is the avascular necrosis. That is reduced blood supply to the hip joint and getting arthritis of the hip. Then comes robotic. If we are doing direct anterior along with the macro robotic, it is supposed to be the standard of care where the errors of surgery is minimized with the accurate implant positioning by the robotic assistance, and if surgeon is able to recreate that surgical steps in the direct anterior, definitely patient will have excellent results. There is no harm in getting surgery done with a posterior approach also. It is approaches. There are different approaches: lateral, anterior, posterior. This is a choice the surgeon makes based on his or her training, experience and expertise. If you have liked this video, please like it, share to your family and friends. Don't forget to subscribe to my channel for informative videos on hip surgeries, knee surgeries and shoulder surgeries.